Sancy Leachman, and I am an adjunct professor of dermatology at the Oregon Health and Science University, and I'm also the chief medical officer for SkinBit. Now, I'm very excited to talk about that. And what we presented this year is a poster on Fluorescent. Fluorescent is a company that has created the skin fluorescence imaging system. And that, what it does is it harnesses the fact that when a mole or an early melanoma starts to invade, there are changes in the dermis, in the stromal tumor microenvironment that start to happen. Neovascularization and breakdown of the barriers for it to be able to invade into the stroma. And that is heralded by change, an increased expression of alpha V beta 3 integrin. And so there's a peptide that is fluorescently marked. It's an RGD peptide that binds to that integrin. And so you can apply it to the surface of the skin at the site where the mole of interest is. If you're worried about a mole, you put the peptide on there and it penetrates the skin and it binds to the alpha V beta 3 integrin. And if it's not, then you don't get the fluorescence, right? And so it's a way of determining whether or not the mole is doing anything dangerous really early on. And what we showed is that it works better, really, than what the clinical eye can do alone. And so it's a very exciting time because we studied over 200 patients that had moles that expert dermatologists could not tell if it was a melanoma or a benign mole. It was all of these intermediate lesions. And what we showed is that the Fluorescent SFI, skin fluorescence imaging device, did better than the dermatologists at identifying the ones that the pathologists thought were dangerous and identifying the ones that the pathologists thought were benign. So that's a major advance forward to being able to really understand which of the lesions you need to biopsy that you don't understand. You're looking at these lesions that can't really tell clinically whether they're anything dangerous or not, but by using this stromal remodeling marker, you can tell that this is one that's actually progressing and it probably should be removed, even though the naked eye can't do that, and even dermoscopy. So it's a big advance, and I think it's going to bring a lot of improvement to the care of patients.